Sure. I'm Don Mills, and I am a board-certified anesthesiologist, and I practice in Newport Beach doing interventional pain management. The body needs omega-3s because they are essential fatty acids. Essential means that they are not produced by our body. We need to ingest them. The body uses these for the stabilization and building blocks, if you will, of all of our cellular functions. They're involved in membranes, in the brain, in all the different organs of the body. So in the short term, it's part of the body's way to begin the healing process, but when it becomes a chronic condition is when it becomes debilitating and painful to the patient. Started taking it, didn't tell anybody else in my family that I was taking it, and within a few days noticed much better sleeping habits. I'm normally one who will toss and turn and try to cure all the world's problems at night, and I noticed that I was going to sleep and waking up in the same position 6-7 hours later. Also noticed an increase in mental clarity and energy and being able to focus on multiple tasks at one time. So MOXXOR is a pure form, a uncut, undiluted form of omega-3s in a very small tablet that can be easily ingested with no side effects. I have a very busy pain management practice in Newport Beach, and one of the things that patients will come to me with is that they want to get off the prescription drugs that they're on. All of the prescription drugs, narcotics, have many GI side effects, upset stomach, and ulcers and gastritis, and not being tolerated well. So do the anti-inflammatories. So I have a lot of patients that want to be off their pain medication and off of their non-steroidal anti-inflammatory medication. If you look at what I used to take before I found MOXXOR, is I would go to Costco and buy the omega-3 that they had. I couldn't tolerate the pills because they were very large and they had lots of side effects for me, gastrointestinally wise. In other words, I would feel kind of bloated from them. I would get this sort of fish burp that is unpleasant, and it kind of upset my stomach to where I have to kind of scale down what I was taking. With MOXXOR, I don't experience any of that. But the difference is that when I started to learn about it, and I learned about MOXXOR as an alternative, I found that what those fish pills actually have is they're cut a lot. There's a lot of supplemental fillers that are in those pills rather than just the pure omega-3. How long has the source been in the food chain? Of a blue-green algae that a mussel will then ingest and now be the original source or primary source, beginning source, if you will, of the omega-3. I would rather get it directly from that source than from a fish that's eaten a fish that's eaten a fish, and now some 10 years later I have a piece of salmon and I'm getting my omega-3 from something that's been in the food chain for several years. What I've been able to successfully do in my interventional pain management practice is substitute omega-3s in the form of MOXXOR to my patients, and their satisfaction has been incredible. They've been able to delete from their daily regime prescription medications that not only cost more and require them to keep track of what they're taking and when they're taking it, but they're also not having the side effects associated with those prescription medications. What I've noticed is friends and family members that have sort of gotten used to a pain in their body that it's just been there, and it's never gotten better, and it just sort of over time just became accepted. And what they noticed when they tried supplementing their diet with an omega-3 in the form of MOXXOR was that it was gone. and it was like something that they have just sort of always figured was going to be their anchor and their ball and chain, and now it was lifted away from them, and they were able to go back and do things at the level and quality of life that they had before. So lots of experiences with that, where people are just so used to, oh, my knee is always going to hurt, and then all of a sudden it didn't. Or, the ankle that I broke playing volleyball or riding my mountain bike, that pain, that creak, that click every morning, I don't have anymore. My challenge as a interventional pain management doctor is to address the complaints that my patients have, and these are muscle pains, knee pains, hip pains, multiple joint pains, as well as complaints of pain in the spine, the neck, the mid-back, and the low back. I've been able to successfully address and correct these patients' complaints with MOXXOR as the source of their omega-3.